Good evening, everybody. Thank you so much for joining me tonight on YouTube Live. I'm Dr. Howard Elkin, the medical advocate. And tonight we're going to talk about my new book, From Both Sides of the Table, When Doctor Becomes Patient, Becoming Your Own Medical Advocate, which is really what it's about. Now, the first part of the book is about my story because I had to learn how to become my own medical advocate. But then it's really more about everybody else out there, all of you. I want all of you to become your own medical advocate. And we're going to talk about that tonight. We're going to have a series of conversations about the contents of my book, but tonight's kind of like an overview about what the book is all about. And so stay tuned for future weeks. So, what is a medical advocate? How did I get that name? And what does it mean? Well, some of you might know, some of you might not, but I was hospitalized twice in a span of 19 months a few years back for two entirely different reasons. And both times I had to really, I wouldn't say bulk through the medical, I had to really learn a lot about myself and what I could do to take control of my health. I mean, I thought I was in great health, but obviously I wasn't. And I learned to grab the bull by the horns and stay in the driver's seat as related to my health because I learned quickly that the current medical model was just not going to sustain me. There was something more that I had to do. And you'll read about that in my book. And so when I've been working very closely with a speaking coach for several years now. He said, "You're the medical advocate." I said, "What do you mean?" He said, "Well, you became your own medical advocate, and now your job is to teach others. I train people to become medical advocates." And that's a title that I take seriously and I really appreciate it. So, what is a medical advocate? It's staying in the driver's seat as it relates to your health, it's taking control, it's reclaiming your power, the power you have. And we were born, right, with our birth itself. It's like our claim to life. And no one should take that away from you, at least theoretically speaking. So, why is it a big deal, and how big of a deal is it? Well, it's a really big deal. If you look at the health of this country, we're not doing well at all. Despite spending more on the gross national product than any other developed country, we do really, really poorly. Okay, so if you look at, and I've talked about metabolic problems in the past. Metabolically, we are not doing well at all. Right, there was a study that came out prior to COVID and the end of 2009 to 2019, and it was an NHANES study published by University of North Carolina at Chapel Hill, and actually only 88% of American adults are metabolically healthy. That means only 12% of us meet the grade. So what do we mean by metabolically healthy? There's usually five criteria: elevated blood pressure, elevated blood sugar, truncal obesity. That's 35 inches if you're a woman and 40 inches if you're a male, high triglycerides, and low HDL, or healthy cholesterol. Just imagine if you have three of those five, you're not metabolically healthy. And that's most people in this country. And that's pre COVID. Now, they've done some similar studies post COVID, and that number has dropped like from 12% to like perhaps 5%. So we're only doing worse as a country. Now, if you look at COVID itself, COVID-19, I think there's like in this country alone, greater than 96 million cases and over a million deaths now in the 2.5, or nearly 3 years that we've been dealing with this, over a million deaths. And so what are the major things that lead to death? Well, age is probably very important because as we get older, our immune system gets more faulty. And no one seems to address that issue as we get older. We just deal with illness. In fact, there's so much money that is spent in Medicare for the last 2 years of life. It's just ridiculous. Who can enjoy life when you're in the hospital and constantly dealing with medications and side effects and so forth? But so a faulty immune system, age, and coexisting conditions: hypertension, diabetes, COPD, emphysema, and so forth, and cancer. So those are all bad things. What about younger people that die? Well, usually it's people of color, okay, and there are racial disparities when it comes to healthcare delivery, unfortunately. And the other is obesity. A lot of these younger people that were obese died. In fact, if you look at people that are hospitalized with COVID, and I believe the early data was that 80% of people with COVID never had to hit the hospital, and 20% did. Of the 20% that did, 78% were obese. So that's what we're dealing with. So if you look at the obesity in this country, it's like 42% now. It was like maybe 30% when I started off my practice. Now we're up to 42%. And nearly 75% of the population of this country is overweight. I mean, it's not good, guys. It's just not really, we aren't moving in the right direction. And to top things off, the United States has the lowest life expectancy at birth, both with men and women. We trail far behind other developed countries. And so, what are the differences that make this country do poorly? Well, affordability. Black people can't afford health care. Administrative efficiency. There's such a bureaucracy. I don't have to tell you about that. Equality, before I mentioned racial disparities, and outcomes. We aren't doing well. So, how do we improve? Which is why I'm on this mission, this crusade, to become your medical advocate. What can we expect? And I met someone for dinner a couple of weeks ago. He said, "Well, maybe we should expect more from our legislators." I said, "Are you kidding me? Do you think the government and legislation is going to improve the status of healthcare in this country? I don't think so. What about hospitals? Hospitals are out for a profit or to break even or to they're not in, they're into getting you in and getting you out. If any of you have been hospitalized lately or have a loved one that's been hospitalized, you know what this is all about. What about medical providers? I'm a, uh, I hate to say that, but I'm a doctor, right? We're medical providers now. I don't think that's going to happen. Doctors are burnt out now. Why do you think I'm in my own practice, my own solo practice? Because I don't have to be told what to do and how to do it. But doctors are, there's so much red tape, getting tests approved, going through insurance BS, so that I can perform a stress test on you, an echo on you, or do an angiogram on you. Even though I'm a doctor with a lot of experience as a board certified cardiologist, I don't run the show. Your insurance company does. It's pretty sad when when medical decisions are mandated by business professionals, but that's what's happening. So it's not expecting these other great entities to do more. It's not, but it's also not about expecting any less from the medical establishment. So what's it about? It's about expecting more from ourselves. The power is within ourselves. And I think the only way we're going to make the grade and really improve the healthcare is by us doing more. And that's what I'm talking about when I mean become your own medical advocate. So it's an active role. We all can do it. What are the characteristics? Okay, know your body. Okay, now when you read my book, when you read chapter one, you will see that I was totally out of touch with my body. And I had been a cardiologist for like 25 years, and I totally denied my symptoms. It just couldn't be me. I was like your typical male. Okay, typical male. And I just wasn't, I didn't take heed to what was going on until it creeped up on me. So 12 hours after 14 hours, I think, of having intermittent chest pain, I finally caught on, and that was it. So know your body. Be a pest. Ask questions. I have patients that come to me with a list of questions, and I actually welcome that because they've done their homework. They're ready. They're prepared. Why this? Do I need this medication? Can this supplement help me? Do I need more exercise? How can I get better sleep? I love it when patients have questions. So, if your doctor has one foot out the door when you come in there, you got to think about whether that's the right doctor for you. You might have to find someone that can spend that time with you and answer your questions. Do your research. There's plenty of stuff out there on the internet to learn about all you can. Learn all you can about your condition or wellness or whatever topic you want. There's a lot of garbage out there too, but you have to know how to go through it, sift through it. And also helps to have a doctor who can help you navigate that what's real and what's not good. And my basic hint is if they're trying to sell you something, it's probably a conflict of interest. The other one is trust your intuition. Nobody knows your body better than you. No one. Nobody can be inside your body. So when I see a patient for the first time, I intently listen to them. Even though it may seem like it's totally off the wall, I get a lot of hints by listening to the patient. It's very important that you be heard. And that's still a major complaint that surveys have shown year after year after year that most patients do not feel heard by their doctor. That's a shame. You need to be heard. You deserve to be heard. And the other thing is trust your vibes. If you don't feel good about with whom the doctor you're with, you may need to consider a change. So I'm going to give you a few examples, and then I want to hear a few from you because how I took the how I took the driver's seat. So I'm got a little few lists here so I don't forget them. Okay, so I was hospitalized twice for two unrelated reasons, and you'll read all about that in my book. So the second admission was for back surgery, which was relatively not urgent but emergent. Like I couldn't walk, so I didn't have surgery, and it was a botched up job. I had permanent nerve damage as a result of the surgery, and the surgeon did not really correct the problem. I had a relapse 7 months later, and the relapse showed that my spinal stenosis, which was critical, it became severe. I went from critical to severe, and that ain't good. But anyway, be that as it is, I ended up being in rehab, going into rehab the first admission, the second admission, because I couldn't walk. Now, this is what I had to deal with. The discharge planner comes to me the second day after surgery, says, Doctor, I've tried everything I can, but your insurance company will not allow you to go to rehab. They say you need to go to a nursing home. I said, are you freaking kidding me? I'm not going to a nursing home. I was, 55 at the time and in excellent shape. I spent 3 hours on opiates, doped up, in pain, on the phone, not able to even move. And I got my way. I insisted that I be in rehab. And I got a ticket to rehab, and that's where I was transferred later that day. But I mean, if I didn't fight it, I wouldn't have got it. So it's really amazing. That's being a medical advocate. Okay, after that relapse, then I had a relapse 9 months later and then I need to have a second MRI. So I tried to contact my surgeon, who kind of like left me after he knew that I sustained permanent nerve damage. So it was hard to reach, but I need to have a doctor's order to get the MRI. So he ordered one, a straight MRI of my lower spine at Cedars. And doing my research, I learned that if you've had previous back surgery, you're going to have one with contrast, because with the metallic, the magnets and so forth, you're going to get too much reverberation of metal. So you really won't be able to get a clear cut picture. So I did that research. So I called the doctor of the procedure. Both my office manager and I spent numerous phone calls trying to get him. He never answered us back. So I went to Cedars that night, had my MRI at 7:30, and the technician said, wait a minute, you've had surgery. This is going to be worthless. I said, I know. I tried to contact my doctor. Can you do it? She said, no, I can't do it. I said, well, I'll write the order. I'm a doctor. No, you're not the ordering doctor. I said, are you serious? So I had an MRI that was totally worthless. Then I had a second opinion from another neurosurgeon and got the proper MRI about 2 weeks later. So I had to go through the expense and travel distance of 2 MRIs. Really crazy. Another time I had to get my very dear friend, who's a retired chiropractor, turned me on to 2 neurosurgeons when I know I needed to have a second opinion. The first guy was a total, I won't say it, not nice guy. I came with my oldest daughter because I didn't want to miss anything. He didn't look at her. He didn't look at me. He said, why are you here? I said, why am I here? Did you not read the synopsis of what I said 4 days ago and as I filled out my registration materials? No, I didn't read it. So I gave him my story, and it was not fast enough for him to. He said, let me see you walk. So I walked. He said, that's it. Okay. And your MRI is worthless? I said, I know. I didn't get it with contrast. He said, you know what? This is a waste of my time. You need to have this test, this test, and this test. I'll have my assistant come in here, and she'll schedule it for you. And I looked at my daughter and said, you know what? We're getting the hell out of here now. I do not have good vibes about this guy. I don't want him working with me. I don't want to work with him. That's being my own advocate, folks. I was going to take it. But another one that just happened a few months ago. So now I'm back at Cedars-Sinai because I'm still fighting this back problem, which has deteriorated over the years. And I'm about to get this test called an electromyogram. Okay. And electromyography. So it's a test that tests your muscles and the nerves that supply them. And it really gives you a lot of information about your nerve damage. It's not a pleasant test. So I go in there, and it's being done by a fellow, not the doctor that's supposed to do it. He comes in there, looks at the test. He said, and I said, well, aren't you going to do both sides? The fellow just did my left side. Why? There's nothing on the right side. I said, what do you mean? Well, you've had damage there. It's just worthless. I said, wait a minute. I did walk here on my own, 2 feet, without a device, a wheelchair, or a walker. He didn't care. Then he looked at me and asked me a question that floored me. He said, are you active? I said, am I active? Are you freaking kidding me? I used the F word. I just was fed up at that point. Imagine, would he not even look at me? Am I active? This is what happens, folks. As another then I want to hear from you. As another example, my partner has advanced kidney cancer, and they gave him a second immunotherapy agent. And after the second dose, actually they dovetailed onto another immunotherapy agent. We had totally dysautonomia, in which his blood pressure, his autonomic nervous system just dropped. So he would stand up, and his blood pressure would go from it would drop 60 points, in which he had to literally get to the floor, or he was going to fall. This went on for 6 months. We saw every specialist at UCLA. You name the specialist, we saw it. You name the drug, he was on it. He just nothing. If anything worked, it would be just for a few minutes. It was amazing. So finally, I called a good friend of mine who's a functional chiropractor. I said, Suzanne, you got to help me here. Is there anybody that could help? She said, yeah, this Dr. Edward Wagner in Pacific Palisades. I looked him up. I called him the next day. I wasn't going to schlep there if he was going to, do anything. And he said, this up my alley. I brought him there that Saturday, 45 minutes. What did he do? Muscle testing and kinesiology. And the average medical professional doesn't even believe in that. We walk out of there, and we're at the front desk. And he said, Howie, I'm not dizzy anymore. I said, what? Are you sure? He said, yeah, I'm standing, aren't I? One visit, 145 visit, cured him of this dysautonomia that he had for 6 months. And we saw wonderful specialists at UCLA. I have nothing negative to say about UCLA. Just the traditional medical model failed. It wasn't able to do what this functional chiropractor did. This functional chiropractor knew neurology. So, folks, you got to look outside the box sometimes. Had I not searched for this, it wouldn't have happened. But you don't have to be me. You don't have to be a medical professional. You don't have to have a medical background. You have to trust your body, trust your instincts, trust your intuition, and go with your vibes. Because if you don't feel comfortable, you have to seek help elsewhere. Those are some simple examples. I can give you a few more, but I'd rather hear from you. So does anybody have a question about medical advocacy or what they can do? I try to give these examples. Oh, good. Let's see. I can't believe the doctor asked. Yeah, he asked me, was I active? To this day, I can't. I can't. I'll tell you one more example that just happened. So a patient of mine that I've had for several years, she came in to see me yesterday, but her daughter was with her. Her husband was also my patient, but he passed away almost a year ago. So the daughter says, well, guess what? I'm a member of Kaiser, and I'm now an AFib. And she's in her early 60s, a very active woman. I said, what are they doing for you? Well, they gave me a bunch of drugs, including a blood thinner. And I can understand blood thinners are important. I said, they talk about how you're going to get out of AFib? She says, well, no, they said my heart's enlarged and that nothing would really work. I said, really? Did you get a copy of your echo report to know what the dimensions were? Did you seek a second opinion? No, they just said I'm not a candidate. I said, okay, so you're going to be on medications the rest of your life. And you're going to suffer the consequences of being in chronic atrial fibrillation without doing anything about it. That's not the medical advocate way. The medical advocate way is, I'm going to get a second opinion. I don't care if I have to pay out of pocket. I'm going to do what it takes to get everything all my ducks slide in a row so that I can achieve wellness and good health. So, folks, that's what I'm talking about. It's no magic power. It's work. It can be work. Yeah, you can be a pest, but the gratification of being successful by doing your homework, by trusting your body, by listening to your instincts, it's immeasurable. And I didn't start off that way, despite my medical background. If you think doctors make good patients, I'm here to tell you that it's not true. Doctors and nurses are not great patients. So it's like I take my job as a role model very seriously. So I do walk the talk, not because I'm better or smarter than anyone else, just that I've chosen this path for myself. And now my crusade in writing this book is for you to do the same, for you to become your own medical advocate. And then the next several weeks, we'll be delving into the book itself, and I'll break it down for you. Of course, there's no excuse for you not to read the book. And I do suggest that you read the book. And again, I'm going to hold it up for you. from both sides of the table when doctor becomes patient. Subtitle is Become Your Own Medical Advocate. And what I suggest you do is go to I have a new website devoted to my book. It's called BeYourOwnMedicalAdvocate.com. BeYourOwnMedicalAdvocate.com. It's a new website and has an overview of the book. And it's got some really information about it. It's a link that says buy now. Please click onto that link and purchase a copy. You can get a Kindle for 99 cents for a limited period of time, or you can get the softback, which is this book right here, for $18.95. Now I will, and I'm asking for all of you, please, I'd be real grateful if you would write a review, because I need to have a stellar review. Why? Because Amazon is all about reviews and numbers. Some people spend thousands of dollars to get their book up to number one. Well, I'm not going to have the money to do that, so I'm going to be dependent on reviews. So just one word of caution: if you get the Kindle version, please make sure you thumb through 60, I think 70% of it. They know through Kindle if you've gone through 70% of the book. If you haven't and you try to write a review, it will be discarded, and worse yet, they may discard other reviews. So I would be punished. So please don't write a review on Kindle unless you've read 70% of it. However, if you get the softback edition for $18.95, no one's going to know. You can do whatever you want. But the important thing is to get the book, BeYourOwnMedicalAdvocate.com, and please write me a review. It really helps. I'm so happy to share this with you. This was a 10-year project for me, writing and editing, and I loved it. But now I thought this was going to be the hard part, and it's just a lot of marketing involved, but it really is a crusade. I see where medicine is, where it's headed, and it's not in a good direction. I gave you that background information tonight, and I want you to really let that sink in, because if we really want to see change, it's us, it's me, it's you. That's the only way it's going to happen. It's not going to be our legislators. It's not going to be our hospitals. It's not going to be our government. It's not going to be Medicare. It's really up to us to really make that difference. So, okay, let's see if I have any questions here. I have glasses on. Okay. How do you pick out a doctor for yourself? What things should you look for? That's a good question. First of all, you want to be heard. Okay. Again, I reiterate this. The complaint that people have had since medical surveys have been done is that people do not feel heard. Okay, doctors have their own agenda. Now, if you work for an HMO or a big group that I don't have to deal with, you are told to spend no more than 8 minutes in that room with a patient. If you spend any more than 8 minutes, you're not being cost effective. Imagine me being told that I'm not cost effective when I have a patient. I deal with people that are grieving. They just lost their spouse. They just lost their child. They just got hit with a serious illness. And I'm told how much time I can spend with them. So you need to interview doctors like you would interview someone for a job. And if they need to have compassion. They need to be a good listener, and you can tell if you're really intuitive, you can tell whether they are able to listen to you, and can they answer a few simple questions. What's your feeling on supplements? A lot of doctors don't believe in supplements. They don't want you to believe in them because they aren't taught about. I wasn't taught about them either, but I've taken them on because and I have a whole chapter on it in my book. So you got to find a doctor that agrees with you. If you're taking a bunch of supplements and you're afraid to tell your doctor because they might fire you, not the right choice. So I believe you can pick out the right doctor, by going in there with a few questions. And if it doesn't work out, if the vibes aren't good, guys, get out. That's what I did. I was going to take that neurosurgeon. I mean, I could see him not looking at me, but he could look at my daughter, who's cute as a button. It just made no sense. He was really nasty, very cold. Okay, audiobook. Yeah, I am going to do an audiobook. And I was going to have someone do a voiceover. Well, that's what my consultant said. You should have someone do voiceover. But when I reread the book for the last time, for my last edit, the chapters are the part about my story. I don't think anyone, even a professional actor, would never be able to display the degree of emotion that I have, having gone through what I have. I mean, you'll see. I went through hell and came out as much as a winner as I could, because I think I wasn't going to be a victim. I was going to be a winner in one way, matter, or form. I'm still fighting it, But so it will be an audiobook probably in the next few months when I get, because it's a big chore in itself, and I think I can do it better than anyone else. Thank you. Okay. Uh, Thank you. My dear cousin Elaine said, "Can't wait to read it, Howard. And your book will be my holiday gift to family and friends." By the way, so that's why I really wanted to get this book out by the end of the beginning of October. Is that it's a great holiday book to give to family and loved ones. So it's one of my main reasons of getting out at the time that it did. So yes, it'll be an audiobook. Yes, it's a great gift. And how do you pick out a? We talked about picking out a doctor. Um, Anything else? Anybody have any? I mean, it's hard since we don't have an open discussion. I'd like to hear what other people feel about their medical providers and so much, or the examples that you've had. I think one day when I'm at a real audience, I'll usually pick people in the audience and say, "Hey, give me an example of how you became your medical advocate. Or what did you not like about this, that, and the other?" But we'll do that in another forum. This is not the greatest forum for that because it's just me, and I don't get a chance to look at you. You get a chance to look at me. But it's so if anybody doesn't have anything else, we need to thank you. I think we all need to hear this, and we need to. What I'm just looking for is action. An action plan. You can do this, people, folks. You can do this. You don't have to be a doctor, and you want to pick. You want to be with people that agree with you and feel the same way. Um, And that's the whole thing. It's about being positive. It's about being, you know, this is a can-do thing. This is a can. You can be victorious, and I don't care if you're perfect health now and you want to just be healthier as because to me, wellness is more than the absence of disease. It's about being in optimal health, and I don't care whether you have a chronic condition or whether you don't. We can all be healthier, and that's something else I didn't mention. At least 50% of adults in this country have one chronic illness, at least one, if not more than one. Like I said, we're not doing well. So I guess as long as the country is in this kind of shape, I'm going to keep preaching this stuff because someone's going to hear it. So, you guys are great. So thank you. I guess we'll end early tonight because, this is just kind of like an overview of my book. We'll meet in 2 weeks and I'll probably talk about my story. Um, some of you would have read it by that time, but give you an idea of what I went through and what I did to improve my lot in life. So thank you so much. I'm very grateful for your attendance. Please click on the like button. That does help my ratings. And again, purchase my book, beyourownmedicaladvocate.com. And we'll see you in 2 weeks. Okay. Good night, everybody. Thank you very much.